My name is Sophie Birens de Haan, and I'm recording a few videos about my experiences with breast cancer treatments over the past 18 months. I'm 61 years old, and this particular video I'm recording is about my experience with chemotherapy, but I'm doing it in two halves because I would say that chemotherapy was the most difficult part of the whole treatment experience because it lasted 4.5 months. And even though the oncologist says, oh, you know, chemotherapy doesn't leave scars, so you forget all about it, I'm 4 months past it, and I haven't completely forgotten all about it just yet, and I'm recording it before I forget all about it. So, yes, the first 3 cycles of chemotherapy will be on a separate video. It was a separate set of drugs. It was epirubicin and cyclophosphamide. And this video is about the last 3 cycles where I was given only the one drug, docetaxel. And in my treatment plan, before the start of any new cycle, I have an appointment with the oncologist to check how I'm doing and whether I'm ready for that next cycle and that kind of things. So on that appointment, the oncologist say, oh, you know, with docetaxel, you won't have any nausea. And I nearly jumped for joy because I thought, wow, that was a big bugbear in the previous cycles. I thought, okay, that's good news. But she said, you'll have other side effects and you'll feel a bit like flu-like symptoms or achiness, and you might find that the side effects you have are cumulative. And yes, she was right. I did experience that. This video, I want to talk about 3 things to do with these cycles. The one is the kind of pattern of side effects I noticed. Second is the level of activities one is able to maintain during chemotherapy. I mean, obviously it varies between people, but the guidelines they encourage you to keep active. So I want to talk a little bit about what challenges that presented for me. And the other one is about the more lingering aspects of the side effects and the ones that are a little bit that came later in the cycle and were a bit, and for me, I didn't expect them. And the one thing I want to say before I start is that before I was diagnosed with breast cancer, I was a very healthy person, only taking the odd ibuprofen, paracetamol if I had a bad cold or something. But I really have not spent the night in the hospital before my surgery. So it's all new to me to have such strong drugs and such strong side effects. So I might react like a bit of a diva about it, but I just wanted anyway to share the experience in case others are going through similar things. So in terms of the patterns, on the day before the infusion, I had to take a fairly hefty dose of steroids, and same on day 1 of the day of the infusion and day 2. And during those days, I was actually feeling quite well. I have energy. I could do everything I was doing normally. So that was the infusion was on the Thursday, so that was heading towards the weekend. So I was nearly looking forward, saying, "Oh, this is the end. This is nearly the end of it all." But day 3, lunchtime, the steroid wore off, and then I was asleep on the sofa or something. It was really, the energy was really low, and then these achy muscles set in, so I had to take paracetamols. So days 3 to 10 were usually the more difficult. Maybe that period being slightly longer in cycle 4, maybe it was day 3 to 9, and maybe day 3 to to 10 in cycle 5 and day 3 to 12 in cycle 6. So that's where the cumulative notion comes in as well. So yes, I had mouth cells, but that I could deal with them quite nicely because I was given a mouthwash that was both antiseptic and soothing, and keeping a good mouth hygiene helped. Had the odd chemo rash that was worst in the cycle 6, covering larger areas of my body, but that disappeared within 48 hours, so it was not a big deal. I just rubbed a bit of bio oil on it and it disappeared pretty quick. The other thing I noticed was, except for the low energy, the Sunday usually of days, which was day 5 I think, or day 4, the only energy I had was to watch films and build jigsaw puzzles and try to take my mind off things. I didn't do anything really activity-wise. And the worst, I think the biggest bugbear for me in those 3 cycles was how my taste buds were impacted. The taste of things was like a bit of a hallucination of a taste. For example, feta cheese, which I normally love, suddenly tasted like manure. I mean, I've never eaten manure, but in my imagination, the smell of manure, something pungent and a bit, I don't know, not herby-like, but really, that's how it changed my imagination. So suddenly feta cheese was disgusting, and the mix of flavors were a problem. If I had an avocado on its own with a bit of salt, that would be fine. But guacamole with coriander, onions, lime, no, not at all. It suddenly became a very chemically tasting sort of mixture. This was also disgusting. And so yes, that was a big bugbear. And the texture were affected as well. So a bit of soft bread, which I thought would be bland, it would be nice, with butter on it, and suddenly you get past the butter and you get this furry texture in your mouth that is horrible, as if you're eating something that was inedible, really. You eat raviolis and the center of it is only ricotta and spinach ravioli, mild flavors, and the inside is so bitter that you leave it and you eat only the outside, or that kind of things. So yes, the one thing I could cope with during the most difficult days were a poached egg, because that was smooth and the taste was fine, and creamy yogurt, especially the caramel flavor. For some reason that was preserved in my taste buds. I'm sure there is no rhyme or reason to all these things, but it was a strong experience for me, and still is to this day. It's now 4 months after the chemo and I still have bitter taste in my mouth between meals. I enjoy the food with pleasure during meals, but between meals I've got to swig water to rinse my mouth every now and then. Yes, so there was an extra twist on days 5 and 6, where on day 7 of cycle 5 I developed a fever. I had been in person in the office on day 6, and maybe that was too much, I had overdone it. So on day 7, in mid-afternoon, I developed a bit of a fever. It was not very high, it was only 38, but I thought, okay, I'll just take my temperature again, half an hour, maybe an hour's time, check it out. And it didn't seem to want to come down. So I followed the guidelines, I rang the emergency number, and they asked me lots of questions, and then they said, oh, you need to come in to the hospital. And I wasn't very keen because I didn't really want to spend the time in the hospital. But anyway, my husband drove me there, and I walked into the acute oncology department, and I thought they would keep me there for a few blood tests and then send me home late in the evening. But in fact, they found that my neutrophils counts was low, so they decided to keep me overnight and put me on intravenous antibiotics. Even though they did lots of tests and didn't find any infection, it was a precaution. They put me on a broad spectrum antibiotic drip and then gave me some tablets and sent me home the next day. And my best friend was very kindly came into the hospital to talk to me, and that was so nice. But anyway, so that was a night in the hospital I wasn't expecting. And on the back of that, the oncologist decided to reduce the next dose for cycle 6 by 20% to make sure this doesn't happen again. But in that cycle, my husband found himself testing positive for COVID. And I thought, oh, I had COVID in April 2022, so should be immune. It won't be a worry for me. But lo and behold, I developed a fever on the 8th, and again, it wouldn't come down. And I thought, oh, but if it's COVID, it's not an infection, therefore it's not so dangerous. But when I tested myself, I found it was negative, so I thought, okay, I'd better ring that number. Same thing, my husband drove me to acute oncology, and because it was late in the evening, it was 9 o'clock, they kept me there overnight, and they actually found I was COVID positive. So they put me in an isolation room for that night and gave me an antiviral and then sent me back home. So that was not a serious thing, and the rest of the cycle was the usual side effects. So, yeah, dry mouth, here goes. So, about the levels of activity, I find that on day 1 and 2, I could walk as fast as I want, go as far as I want, it was all fine. But after that, I had to decide each day what I was able to do. And I'd say that day 3 and 4 and 5, it was in those days, it was the weekend anyway, I just took it very easy. On day, sometimes I was able to still join in, even just to be present with my singing friends when we are doing the vocal technique sessions. My singing teacher runs a really lovely little singing community called Virtually Vocalies, and we have a lot of activities throughout the week to join in. And in that case, just to take my mind off things and to be there, even if I couldn't do the singing exercise as such, even if I had to sit down and mind them or do a different alternative version of them, I was still feeling I was joining in, and that made me feel good. So sometimes it's not even doing the activity, it's just being with the people you normally do the activity with that can sustain you as well. But otherwise, I was taking it very easy. Day 5, I was working at home, but usually signing off mid-afternoon saying, I've had enough, I need siesta. And day 6, I made the effort to go into the office because of the guideline to stay active, because it takes me into the fresh air, because I'm working there, meeting my colleagues in person. So I felt the need to do that. But again, usually I'd go home a bit early and fall asleep on the sofa on day 6. And after that, I would, from an energy point of view, things crept back up. The food was still a bit horrible, but at least I was starting to see the beginning of end. But I was still taking it easy. I might take a walk in the common, but maybe just half hour, maybe not necessarily going excessively with the exercise. And the other thing as well, there was a difference between cycle 5 and 6, because on cycle 6 they took away the PICC line, which is a tube in your, they push through your upper arm towards your heart to deliver the chemotherapy through it. And that needs maintenance. There's a district nurse that comes changing your dressing, or you go to the hospital having change. And it also, you have to be careful when you clean up, you have to cover it when you have a bath or a shower. You have to, you can't exercise, you can't do yoga with it. So on day 6, when they took away my PICC line, on the day of the infusion, I thought, wow, this is the beginning of the end. And then, as soon as my energy allowed, I started to go back to yoga, maybe day 7, 8, 9. I started to do very gentle yoga, the stress relief kind of yoga, that kind of thing. But I did notice that my strength was a bit lower. Like if I was leaning on both my arms and my legs in the downwards dog, so-called downwards dog position, where it's an inversion, where you have your legs and your feet on the floor, but you are in an inverted position. And I tried to lift one foot up in the air. I found that I didn't have the strength to hold it. Well, before the chemo I had. So it took a little while to rebuild the strength through the yoga as well. Same with the singing, to sustain certain exercise. It took me a little while to get that rebuilt. So days, say 11 to 20 of the cycles were easier. The food was still difficult, but at least generally it was 6 were feeling more like normal in terms of energy and strength. Maybe it was starting to build up. But that's the last point I want to cover, is the more lingering side effects you get with this particular chemotherapy, is that I developed after cycle 6, I think it was in late February, I developed a bit of fluid in my legs. So initially I found it quite painful to walk up slope or up the stairs or to squat. And then I really noticed in my appearance that my legs and feet didn't look like me at all. So that's quite a common effect called lymphedema, I think. And it's fluid build-up in my legs. And I rang the GP just to make sure, because it lasted more than a week. And she said, just keep an eye on it. And, we just kept an eye on it and it went away of its own accord. The other thing was the energy fluctuations. Also, the energy was coming back. It doesn't come back in one fell swoop or not even a progressive slope that goes up. You might find that you have ups and downs with it. So I had a little bit maybe of that during the later part of the cycle. And my eyebrows there were very little left of my eyebrows, and my eyelashes had completely disappeared. So every time I would walk outdoors, my eyes would water. So that would give me a strange appearance. And talking about appearance, my scalp was completely bare, and I had a pale looking face as well, because also it was the winter, but pale as well, maybe because of the side effects as well. So I wasn't looking very healthy as well, which made me feel a little bit vulnerable out there. So yes, that's the longer term. But I would say that now, 4 months after it, except for the bad taste, oh yes, the other side effect that takes a long time to go away is a sensation at the very top of my feet and fingers, even on the behind of my toes. It's a sensation that is in between soreness and numbness. It's very strange, but it's a known side effect called peripheral neuropathy, I think it's called. And that's a common side effect in the tip of your fingers and your toes. And it was a bit sore during the cycle, but it then takes a long time to completely fade. And now it's only maybe 10% there, and I just feel it, but it doesn't really bother me, and it doesn't stop me even doing fine coordination activities with my fingers. So that's absolutely fine. So really the biggest bugbear is that my mouth is not completely happy between meals, but that's okay. Otherwise, I'd say I'm heading into a life after cancer, after chemotherapy, AC, BC before chemotherapy, AC after chemotherapy, and it's going to be all okay, and this is going to grow back. So yes, so that's the end. I will put a few videos, a few photos at the end of these videos, just to show snapshots of some of my experiences. I'll stop here.